Hi, my name is Abby Vetch. I was in a group with McKenna Koima and Korea Timmermans, and we are going to talk to you about multiple sclerosis today. So multiple sclerosis is a chronic progressive degenerative disease. Degenerative is just a process in which tissue deteriorates and loses its ability to function. So you have white matter around nerves in your spinal cord and brain that is called the myelin sheath, and the nerve impulses are conducted between the brain and spinal cord along neurons that are protected by the myelin sheath. This disease affects that myelin sheath by causing plaque to form on it, resulting in inflammation and eventually demyelination of that myelin sheath. This results in your nerve transmission to become erratic or irregular. The good news is that MS will only affect your relative's quality of life rather than the duration of it. So if you see here, this is that myelin sheath that we're talking about, and then that's what happens in MS when it gets deteriorated. And then that affects those nerve impulses that go from your brain and spinal cord. So some of the symptoms of MS that you have been experiencing can include any of the following, like tingling and muscle cramping, tremors, which is just involuntary moving of your muscle, ataxia, which is just a degenerative disease of the nervous system. You can see speech disorders, visual changes, and also bowel and bladder dysfunction. And then to assess MS, we will look at your family's history, your physical examination, and your psychosocial examination. So first we'll take a look at your history. We will determine when your relative first noticed any of these difficulties or whether the symptoms later disappeared. We will ask about fatigue and its progression throughout the day and what stressors make your symptoms even worse. We will also determine whether there's a family history of the disease and look at the history of mild depression and short attention span as well. And then next we'll do a physical exam. We will determine your relative's muscle strength and symmetry, their arm and leg movement, and then also their gait, which is just how they walk. And then lastly, we'll do a psychosocial examination, and then this will help us to determine your relative's place on the continuum of shock, their denial and anger, and their current stage of coping, and just how they're dealing with all their symptoms that they're experiencing. Unfortunately, we don't know the cause of MS yet. Some evidence supports immunological, which is just dealing with the study of your immune system, environmental or genetic factors that all play a part in the possible cause of the disease, but there's no specific evidence of it. However, the risk of developing MS is 15 times greater when the disease is present in the patient's family, which we believe to have been a factor in your relative's case in getting it. We aren't for sure though, but we know it just increases those odds. So before diagnosing your relative with MS, we will rely on ruling out other conditions that might produce similar signs and symptoms, known as a differential diagnosis. We will start with a thorough medical history and examination. Next, we recommend several tests. First, we will start with a blood test, which will just help us rule out other diseases with symptoms similar to MS. Next, we will do a spinal tap, where we will take a small sample of cerebral spinal fluid and remove it from your spinal canal with a laboratory analysis at the end of it. This sample will just be able to show abnormalities and antibodies that are associated with MS. And then a spinal tap can also help us rule out infections and other conditions that might hide your MS diagnosis. Next, we will recommend doing an MRI for you. These can reveal any areas of MS lesions on your brain and spinal cord. Your relative may receive an intravenous injection of a contrast material to highlight lesions that indicate their disease is in an active phase. And then lastly, we will perform evoked potential tests, which record the electrical signals produced by your relative's nervous system in response to any stimuli. An evoked potential test may use visual stimuli or electrical stimuli, and these tests your relative will watch a moving visual pattern or short electrical impulses will be applied to the nerves in their legs and their arms. And then electrodes will just measure how quickly that information travels down their nerve pathways to see if there's any damage, or if it's exceptionally slow, then we know that there's some sort of damage going on in your nerves. And then from there, the diagnosis is fairly straightforward. We'll be able to diagnose your relative with MS by looking at the pattern of symptoms consistent with the disease and confirm it by these brain imaging scans. If you find your relative being diagnosed with MS, we'll do everything we can to give you the best care possible and provide the necessary information to help you throughout this process. If you have any questions along the way, just feel free to ask us. I'm sorry to inform you that there is no official cure for MS. However, there are multiple treatment options to gain better quality of life. With treatment, we typically focus on speeding recovery from attacks, slowing the progression of the disease, and then managing the symptoms. So for MS attacks, we can prescribe corticosteroids to reduce nerve inflammation, or plasma exchange can be done. Plasma exchange is when plasma is separated and moved from your red blood cells. The blood cells are then mixed with a protein solution called albumin and put back into your body. We may use plasma exchange in your relatives' symptoms if they're new and severe, and no, they haven't responded to any other kind of treatment like the steroids. And then also we can administer beta interferons, which are the most common drugs used to treat MS. They work to erase the severity and frequency of flares. However, with these, your relative is more prone to get an infection because they lower the white blood count in your blood. And then there are multiple options to help treat MS, and we will work closely with you to find the treatment that works best for your relative. Fortunately, survival rates for people with MS is improving over time. On average, the lifespan is about 7 years shorter than that of regular people. With your relatives' MS, we want them to understand the need to avoid becoming fatigued, overheated, and to get plenty of rest. This will protect them against any big flare-ups in their symptoms, which is what we are trying to avoid. It's also important to complete the daily range of motion exercises that we have showed you, just to keep your body moving. We want you to develop a regular bowel and urination pattern. We recommend consuming 1,500 milliliters of fluid daily, and then to avoid that every 3 hours. Between your relatives' medications, including their dosage, route, action, and side effects, we want you to understand all aspects of their care plan, which will be crucial to treating their symptoms in the future. Do you have any questions about MS in your relative's case that we can help you with?
Anyone have any questions? You were way over 5 minutes. Okay. Here's your time.
Yeah.